All right, so this short screencast is illustrating what I'm looking for your presentation screencast. You're going to be trying to deliver this as if you were doing a 10-minute platform presentation at a conference. So you're going to be introducing yourself, defining the problem, so having an introduction and presenting evidence and identifying gaps in knowledge. You're also going to present your purpose statement, so the purpose of this study, and list any hypotheses. In the methods section, you're going to present what you will do. You'll notice as I do this presentation, I'm going to be discussing what I did. Statistical analysis section, you're going to present what statistical tests you will utilize. You'll notice that I don't have a statistical analysis section in this presentation. Rather, I go into the results because this was a study that I did, and I'll be discussing the stats in the results section. Again, obviously, you've not conducted this proposed study. I'm just wanting to see what you would do for your analysis. All right, so now I'm going to begin this presentation as if I was giving it at a conference. Hello, my name is Jason Brummett, and I'm representing my research team here, presenting our research study, Prior History of Anterior Cruciate Ligament Reconstruction is associated with future ACL injury in female collegiate athletes. ACL injuries are obviously a significant injury that ends the athlete's season. Surgical reconstruction to stabilize the knee is necessary, and it's followed by months of rehabilitation. So, being able to identify athletes at risk for ACL injury is valuable. The question posed here is prior ACL reconstruction a risk factor for a subsequent ACL injury? Well, Paterno et al. Published a couple studies identifying that high school females were 16 times more likely to experience an ACL injury within 1 year of returning to sport after ACLR, and they were 4.5 times more likely to experience an ACL injury within 2 years of returning to sport after surgery. It is unknown if female collegiate athletes have this same risk. So again, knowing potentially if a female collegiate level athlete's at a greater risk of injury would be valuable for the sports medicine team, the athletic training team at the university, because it may help them to have athletes do specific injury prevention programs. There are also functional tests that are used to discriminate injury risk in athletic populations. The drop vertical jump is one test that has been promoted as a screening tool. It has showed early promise as a tool to screen athletes. However, many subsequent studies challenge the ability of the drop vertical jump to discriminate ACL injury risk. So the limitations of the drop vertical jump are the inconsistent findings, and not all clinics or university settings have access to the motion capture technology. Could other inexpensive, easy to administer functional tests discriminate ACL injury risk? Illustrated on this figure are the standing long jump and the single leg hop. These tests are often used to see about one's readiness to return to sport after an ACL injury. Could they identify people, though, who are at risk? Well, I have published a few studies that have shown that lower standing long jump and single leg hop scores can potentially identify, or that there are associations between lower scores and greater risk of injuries in female collegiate level athletes. So the purpose of this study is to determine if ACL sprain in female collegiate athletes, or to determine the risks of ACL sprain in a population of female collegiate athletes, and we hypothesized that female collegiate athletes with prior history of ACLR would be at a greater risk for a non-contact time loss ACL injury, and we hypothesized that female collegiate athletes with shorter preseason standing long jump and or single leg hop scores would be at a greater risk of a non-contact time loss ACL injury. Well, this study was a prospective cohort study. We recruited 360 subjects between the years of 2009 and 2017 to participate in preseason screening clinics in which we collected prior injury history, and we had them perform 3 standing long jumps and 3 single leg hops bilaterally. Those mean scores were then used for subsequent statistical analysis to determine risk. This table illustrates demographics of our population by sport, and we see that there were 20 prior ACL reconstructions in this cohort. The bottom of the table presents the non-contact time loss injuries per region that occurred during the surveillance period. Of the 360 athletes, there were 7 ACL injuries that occurred. The risk of a non-contact ACL sprain in those who had a prior history of ACLR was significant. If you had a prior ACL reconstruction, you were almost 7 times more likely to have a subsequent ACL sprain compared to those with no history. Interestingly, prior history of ACL reconstruction was not associated with a greater risk of a non-contact time loss injury to the lower quadrant region. So having a prior ACL injury, a prior ACL reconstruction did not increase your risk of having any lower quadrant injury compared to those with no prior history. Now looking at functional test performance. Individuals with lower scores, meaning standing long jumps below 80% of their height and single leg hops below 70% of their height, were analyzed. Those were the at-risk individuals. And individuals with lower functional test performance were not at a greater risk of having an ACL injury. However, those with lower functional test performance scores were at a greater risk of having any non-contact time loss lower quadrant injury. They were 1.6 times more likely to experience an injury to the lower quadrant region. So prior history of ACL reconstruction was associated with a greater risk of non-contact time loss ACL injury. Interestingly, 18 of the 20 individuals with prior history, though, did not experience an ACL injury. Athletes with a prior history of ACL reconstruction were no more likely to experience a non-contact time loss injury. A battery of tests may identify athletes at risk for a non-contact time loss lower quadrant injury. So, female collegiate athletes should be screened for prior history of ACLR. More research is warranted to improve our ability to identify athletes who may also be at risk for ACL injury but did not have ACL reconstruction previously. If you'd like to talk more about this study, there is my contact information, and I thank you for participating in this presentation. All right, so there is kind of an overview, something what we're looking for. I think I clocked that in there right about 9 minutes or so. So your goal is to shoot for 10 minutes or less. And again, this presentation had more of a bent towards what was done. Again, I'm looking for what you will be doing. And a big component of that is going to be in your introduction section, where you're going to be spending probably the majority of your time talking about what the problem is, where there are the gaps in the knowledge, and why your study is necessary. You'll spend a little time again in the method section where you're going to be talking about your study, what that entails, and then spending a little bit of time on statistical analyses, what you'll be doing.